That was the idea of the project. Examine social and community influences. So we know from research that accessibility to certain things in our environment affect our health behavior. We know certain social relationships like parents and peers affect our health behavior. And the idea was to come into a community that has a lot of culture, a lot of tradition, and learn from them and decide from them what they need, rather than trying to pull something from some other research from the mainland. So the idea is to work towards an informed, tailored intervention. And the best part of this, and this is why I think I've been invited here, is because we didn't do the research ourselves. We had the kids do the research, so everything I share with you is something that they went out into their communities and did. And so that's very unique. And just briefly, a part of one of the data collections that we did, we asked the kids about their health behavior. And I want to show you just quickly. If you look up here on the left, the little table there, those are the health behaviors we looked at. So a lot of eating stuff, some physical activity. And if you look beside that, those are national recommendations. The junk food one isn't quite recognized nationally. I came up with that myself. The other ones are national recommendations. And if you look over there in the bar, dark bars, that's the percentage out of 100 of kids here at Waipahu High School that are not meeting that recommendation. So just to exemplify that we do have a health behavior disparity. And if you compare that to mainland research, you see that it's a little bit worse. So just quickly about the phase 2 part, the part that I'm here to talk to you about, what we had the kids do, we collected surveys, and we had them assess the different opportunities and obstacles in their environment relative to physical activity and nutrition. And we also had to go out and map their area. So what you see now, I guess just quickly, we did it from home and school. So within walking distance, there in the middle, let's focus on that one. That's the junk food resources. And the darker bar is a mile from their home. So we're seeing huge amounts of junk food. Yeah, they were even surprised how much. And then the physical activity resources, those things are like parks, gymnasiums, facilities. So there's a good number there, but one of the things that we found is that things that you would expect to be an opportunity like a park is actually something that kids avoid because of the safety issues. So I think you're going to see a lot of our recommendations are directed towards crime and safety. Some of the kids don't want to go out of their house after 6 p.m. and that's really unfortunate because it's a really beautiful community. So that's just the intro of the project. I really want to spend most of my time talking about the recommendations, specific recommendations that